Hi, good morning and welcome to today's health segment on the Breakfast Show. I am Dr. Nakuya Namfaya. This week we are talking about malaria, and yesterday we talked about what malaria is and how it comes about, and we discovered that malaria is a parasitic infection that is spread by mosquitoes, and this only happens when the mosquito bites you and is spread by the female mosquito. So today we want to discover what are the symptoms and signs of somebody that has malaria. How can you tell that you have malaria? So there are various symptoms, and there are so many symptoms, but I will highlight some of the symptoms that are very critical and cardinal to patients that have malaria. So these symptoms include patients who have malaria would have headaches, they will have a fever, they might have weakness, they will have body pains and just generally feeling ill. They might also have other symptoms like yellowing of the eyes, they might have abdominal pain, they might present with symptoms of vomiting, nausea, and sometimes they might have a large spleen. And this is because the red blood cells, as they are being destroyed in the body, they are destroyed in the spleen. And so the spleen will be getting bigger and bigger. So malaria is very prevalent in our communities, and there are so many people that die from malaria every year. In Zambia, we still have a number of people getting sick of malaria, and we need to be able to know that malaria is treatable and we can go to the hospital and get treatment as quickly as possible. So these are some of the symptoms to look out for in people that you suspect might have malaria. So if somebody has a headache, somebody has fever, somebody has nausea, vomiting, weakness, do not hesitate to take them to the hospital, because malaria can kill if it is not treated in good time. So today we are learning that malaria has various symptoms, and some of the symptoms, the common symptoms, are headache, fever, weakness, nausea, vomiting. So make sure that you look out for these things in your family members, your friends, and people in the community, so that you know when to get help and when to get treatment for malaria. So that's the end of today's segment. I hope you have learned something. Look out for other interesting topics that we will discover or talk about this week in the coming days. So keep watching The Breakfast Show and keep watching CamNet TV. Thank you so much for watching.